Now we will see the contents of axilla. So when you dissect out axilla, you have to remove the pectoralis major from its origin and reflect it towards its insertion. And also it should remove the pectoralis minor muscle towards and reflect it towards its insertion. Okay, then only you can reach the axilla. Here the pectoralis minor muscle is retained. You can see that the axilla is filled with fibrofatty tissue, and within it some axillary lymph nodes are embedded. Usually, if the lymph nodes are not enlarged, it could not be distinguished from the fatty tissue. But if it is enlarged, you can see them as grayish masses like this. Okay. So all the neurovascular structures, that is nerves and vessels of the axilla, are enclosed within this fibrofatty tissue. So you have to remove this fibrofatty tissue very carefully so as to expose the arteries and veins. The artery of the axilla is called the axillary artery. The extent of axillary artery is from the outer border of first rib to the lower border of teres major muscle. Above it, it is called subclavian artery, and below this, it is called brachial artery. So it extends from outer border of first rib to the lower border of teres major muscle. You can see that it goes beneath the pectoralis minor muscle and can be divided into three parts. A part medial or superior to the muscle, a part behind the muscle, and a part lateral to or inferior to the muscle. So this is the first part, second part, and third part of axillary artery. Now let us see the branches of axillary artery. Axillary artery gives off one branch from the first part, two branches from the second part, and three branches from the third part. The branch from the first part is called superior thoracic artery. It is a very small artery and you may not get it during dissection. It's a small artery and it supplies the structures in the intercostal spaces and anastomoses with the branches in the intercostal spaces. Arteries of the intercostal spaces. That is superior thoracic artery. Next is the thoracoacromial artery. It is the branch of second part of axillary artery, and just after its origin, it divides into four branches. One branch accompanies the superior border of the pectoralis minor muscle and divides into several branches to supply the pectoral muscles. It is called pectoral branch. Next branch is acromial branch. It goes towards the acromion process after crossing the tip of coracoid process. It is seen beneath the deltoid muscle. Okay, it supplies the structures nearby. Next branch is the clavicular branch. You can see it goes towards the sternoclavicular joint. It supplies the subclavius muscle and the sternoclavicular joint. The other branch is deltoid branch. It accompanies the cephalic vein in deltopectoral groove and supplies deltoid as well as pectoralis major muscle. So you can see the artery just after origin dividing into four branches like a fountain. That is thoracoacromial artery. The next branch is lateral thoracic artery. You can see it is also a branch of second part of axillary artery. Accompanies the lower border of pectoralis minor muscle and it supplies the pectoral muscles and the serratus anterior, the structures nearby. In females, it will have large branches supplying the mammary gland. Now, the third part of the artery gives off the largest branch of axillary artery, that is called subscapular artery. Subscapular artery, just after its origin, it divides into two. You can see one of the branches going towards the scapula. It will wind around the lateral border of the scapula to reach the dorsal surface of the scapula. That artery is known as circumflex scapular artery. Okay. After the origin of circumflex scapular artery, the continuation of subscapular artery is known as thoracodorsal artery. it supplies the latissimus dorsi muscle. Now, the third part gives of three branches. First is the subscapular artery. Then it gives of two circumflex humeral arteries. That is, it winds around the humerus and anastomoses with each other to form an arterial circle around the humerus, around the surgical neck of humerus. They are called anterior and posterior circumflex humeral arteries. So we have seen the extent of axillary artery and branches. Now about its relations. To know the relations of axillary artery, you should know the other structures in axilla also. We can see the anterior and posterior relations in this diagram. The anterior relation, the first part anteriorly, it will be covered by skin, superficial fascia, deep fascia and the pectoralis major muscle. Whereas in the second part, there will be additionally a pectoralis minor muscles also. Okay, first and third part will have skin, superficial fascia and pectoralis major, deep fascia and pectoralis major muscle. Okay. Now, the deep relations, you can see that the first part of the artery lies on the serratus anterior muscle, first two digitations of the serratus anterior muscle, and second part of the artery lies on the subscapularis muscle, and the third part lies on subscapularis, teres major and levator scapulae muscles. You can see the posterior relations also. So, we have seen the anterior and posterior relations. Medial and lateral relations are the structures seen in the axilla, that is the contents of the axilla, like axillary vein and the cords of brachial plexus. We will see that later after considering the veins and nerves of axilla. Okay.